Working on the stream. All right, we are live. Go ahead.
All righty. Good morning, or I guess good afternoon now, everyone, and anybody that may be watching remotely. This is a Board of Health meeting. That today is June 24th, 2020. Amanda, could you call the roll, please?
Commissioner Richardson,
Here.
Commissioner Speer,
Here.
Commissioner Pettit,
Here.
All righty. I think the agenda had a Pledge of Allegiance on there, so if we could stand if there's a flag in your office and join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And it was clear that everybody's shirts were buttoned. That's good. So, alrighty. This is kind of our bi-weekly update. Got some kind of substantial discussion towards the end, but for now I turn it over to Dwayne to provide us the update. Floor is yours.
Thank you, Commissioner. Good afternoon, everyone. Thank you for joining us. Today's agenda includes a status update of COVID-19 in Elbert County, including an update on the number of cases and testing. Talk about the county variance, the third request for variance, and also the stay-at-home orders. You may have heard about Protect Our Neighbors update. I'm going to cover that. And then lastly, I am excited to share that we have some funding coming to Elbert County to enhance detection for COVID-19. And I'll give an update on that scope of work and the amount we'll be receiving in federal pass-through funds. Next slide, please, Eileen. Currently, I should not say currently, we have had 59 confirmed cases to date. That's since the inception of testing in mid-March. We have not had a confirmed case in almost 2 weeks, which is obviously great news. The average age of those confirmed cases is not quite 51 and a half years old. The median age, half the cases are below 51, half the cases are folks older than 51 years old. The range of those that have been infected ranges from a young of 12 years old to a high of 95 years old. Obviously, folks 65 and older are more vulnerable to infection from COVID-19. So the fact that our median age is 51 is pretty good. Nationwide, there has been a trend, particularly in states where there have been recent outbreaks in the southeastern portion of the country, where that median age has dipped into the mid to high 30s. So the fact that we continue to have low numbers and not a disproportionate number of infections among our older population is encouraging news. As of Monday morning, there were 1,224 residents that test performed on county residents. That does not necessarily mean, I should have corrected this point in the slide, does not necessarily mean 1,224 individual residents have been tested. We believe that some folks have been tested with regularity, for example, frontline healthcare workers frontline public safety workers. Like, so we are looking into exactly the unique number of residents that have been tested. Sadly, we have had 3 fatalities among our infections in Elbert County. I want to note that CDPHE in their data continues to list 2 fatalities, but we have confirmation of 3 fatalities. And we have communicated that to CDPHE. If anyone's interested in looking at statewide data, the link is on the slide. It is covid19.colorado.gov/data/case-data. And you can see where Elbert County stands in relation to the other 63 counties in the state. And generally speaking, we're doing really well. Next slide, please. Okay, of our 59 cases, folks have seen this slide before. The majority of our cases are in the northwest portion of our county, and a fair number in the southwest portion, and a couple in the north central portion. Next slide, please. All right, current cases. Presumed active cases, we don't think there's any. In other words, it's been a while since we've had a confirmed case. The virus, we believe, has run its course in those confirmed cases. I should point out that this is not to say that there are cases out there that we're not aware of. There certainly are. However, those folks, again, from previous conversations, folks may be asymptomatic and not realize they're infected. Others may have mild symptoms that they feel don't necessitate, or may not realize it's a COVID infection, or may not necessitate a desire to get tested for a variety of reasons. Next slide, please. Before I jump into this third state-approved Elbert County variance, I just want to share some key messages, some key high-level messages from the state data. State data experts and epidemiologists are tracking mobility. In other words, using cell phone records and other metrics. How are people moving around the state? And mobility has returned nearly to pre-pandemic levels. Looking at hospitalizations on kind of the not so great news, hospitalizations are no longer declining as sharply as they once were. In other words, the curve, while it has been flattened, or made progress in recent weeks, certainly over the last month. That precipitous decline towards 0 hospitalizations has leveled out. It's starting to plateau. The reproductive number, in other words, for every person that is infected with the virus, how many other people are they infecting? And the threshold for action, we want that number to be 1 or less for every person that's infected. We hope that they are infecting fewer than 1 additional person. The reproductive number has increased, however, it remains below 1. So on one hand, it's positive that we're still below that threshold of 1 infection, 1 additional infection, but it is creeping up toward 1. The proportion of statewide cases detected has nearly doubled since early May. That simply illustrates that we've still got a long ways to go, many months to go before we're out of the woods on this pandemic. And want to mention contact tracing. I'll get into that a little bit more in detail in subsequent slides, but contact tracing, why is that important? It has the potential to slow the transmission. The impact of contact tracing depends on the efficiency with which we can trace contacts and the number of contacts successfully traced per case. Another way of saying that is if someone attended a gathering that was infected and they potentially may have exposed, let's say, 25 other people. Contact tracers don't always successfully make contact with those other 25 people. We may not have information on how to contact them. They may not answer their phone. They may not respond to an email message. In the same fashion that folks may not respond to communications that they think are spam calls on their phone or spam email, things like that. So okay, moving on to the third state-approved variance for Elbert County. What was approved? This was a very specific request for variance, and it had to do essentially with two issues. Personal services, for example, estheticians or other personal grooming or salon services. Those were approved to allow for expansion to providers so that when they're performing those services, the client can remove their face covering. Previously, that was not allowed under safer at home orders. It also authorizes sports league tournaments to occur, including for participants from other counties that have low or declining number of cases. The threshold for action that may rescind these and other previously approved variances is 7 confirmed cases over a rolling 2-week period. I should note that in the previous Board of Health meeting, I believe I erroneously had a higher number on that slide on local threshold for rescinding the variance. But again, we've been a couple weeks without a case, so we're in good shape as far as that goes. We have had, I would say, several events or gatherings that we have approved where those numbers have been in excess of safer at home limitations based on our ability to do so with our second approved variance. Those include high school graduations, some equestrian events, some baseball tournaments, a outdoor reception, and I'm trying to think, I know there's others, but the fact that we haven't had potentially any of those attendees at those respective events come back positive is encouraging. We're still not out of that complete window of a 14-day window from the conclusion of some of the events where some of those folks might turn up with an infection, but again, thus far, we're in good shape. Next slide, please, Eileen. I want to take a moment to talk about the difference between public health orders and guiding documents that if you're on the communication email list for my situation updates that I send out during weekdays, you've seen these terms used, or guiding documents in attachments to those communications. Colorado state statute under public health laws allow for public health orders to establish requirements for citizens that Coloradans must follow, while guiding documents provide the instructions generally on how businesses and individuals can comply with those orders. For more information on the Safer at Home and soon to be Protect Our Neighbors phase of coming out of the pandemic, the link is on this slide. It is, for those listening in, covid19.colorado.gov/safer-at-home. And you can also stay up to date by visiting covid19.colorado.gov for any time-sensitive communications that are coming out of CDPHE or the governor's office. That is updated nightly. Next slide, please. All right, so most folks have probably heard about Protect Our Neighbors, the next phase. So what's next? What does that mean? I want to emphasize that we are not automatically transitioning to the Protect Our Neighbors phase. We will have to apply to CDPHE and the state for moving into Protect Our Neighbors phase. Protect Our Neighbors is the next easement of restrictions that allows for things like larger gatherings outside or a larger percentage of indoor gatherings, as well as some business-specific allowances. So the doors aren't being cast wide open. In collaboration with county leadership, including the Board of Health, we will discuss a plan for applying for Protect Our Neighbors. The intent for Protect Our Neighbors, I have initially heard Protect Our Neighbors moving into Protect Our Neighbors in early July. I think yesterday heard the governor was shooting for June 30th to move to Protect Our Neighbors. Obviously, a lot of counties and or municipalities would need to apply for that next phase, and we need to be approved and receive that approval before we could officially announce county is moving into that. So how do we qualify for that? Well, in a nutshell, meeting the established thresholds for lower disease transmission levels, which we can meet right now. If we applied this afternoon, we would meet that threshold. We would also need to qualify by conducting testing and case investigation, including contact tracing and outbreak response. You are most likely aware of our partnership with Peak Vista Community Health Center in Kiowa that is offering testing. There are an increasing number of testing locations popping up outside Elbert County, particularly in Arapahoe County, and I believe some in Douglas County. Obviously, we want to do as many tests on as many Elbert County residents as we can, again, to get a statistically significant sample or percentage of residents tested so that we'll have actionable data. As far as contact tracing goes, we have a contact tracer under contract that is in communication with myself and our environmental health specialist, Stacy Reinhardt. First thing that Stacy does when she comes in the morning is checks the overnight report from the state and epidemiological disease registry to see if there's any new cases that have been reported among Elbert County residents. If you receive my email communications, you'll know that I start out every communication by saying there are no new cases or there is one new case, and with a little description about the individual in that case, gender, broad range of age. I'll say they're in the 40s, and the zip code where they reside. Case investigation, it is estimated that for every investigation, it is approximately 5 hours of time that is spent investigating one infection. That's assuming that R value, or the number of other folks that are infected, is at 1 or less. Some of you may recall early on, we had a threshold, and the planners and the data professionals, the epidemiologists, were hoping that R value was somewhere between 3 and 4. In other words, for every infected person, we hope that it didn't infect more really than 4 additional people. The fact that it's less than 1 is great, but if, for example, that R value increases and our contact tracer has to connect with exponentially more people, that 5 hours may turn into 15 hours or 20 hours. So currently we're able to handle the contact tracing and the outbreak response. So we should, by this definition, be meeting the qualification for this component of Protect Our Neighbors. We do need to do a better job, or a job. We haven't really worked in this space to date, of continuing or supporting, I should say, providing protections for folks that are most at risk for severe outcomes from COVID-19, including folks with underlying medical conditions, pregnant women, and folks over age 65. What that looks like for folks over 65, you're familiar, hopefully, with the Good Samaritan skilled nursing facility in Simla, a couple of smaller assisted living facilities in the county. We will be connecting with them to coordinate training for their staff in terms of disease mitigation. That is actually a component or a deliverable, a requirement, part of the scope of work for some of the funding that we're getting from CDC and is being passed through CDPHE. As far as pregnant women goes, I'm sure that will look something like working with Nurse Family Partnership, with the WIC program that is administered through Tri-County Health Department, and other folks with underlying medical conditions. Will identify opportunities, certainly, to make sure that their risk is as low as can be achievable, and still allow them their opportunities to recreate and to visit physicians and to shop and things like that. For more information on Protect Our Neighbors, the link is on this slide. For those listening, it's covid19.colorado.gov/protect-our-neighbors. One last comment on Protect Our Neighbors. I did get a question this morning about whether or not, if the county applies for Protect Our Neighbors phase, will that cover municipalities, or the municipalities in the county need to apply on their own? I don't anticipate that the municipalities would need to apply on their own. I think we can ask for a blanket movement for all county residents to be covered under Protect Our Neighbors. Hope that helps. All right, next slide. Exactly. When folks are going out, whether it's shopping or recreating or to a restaurant now or even to a bar, I just want to share what things to consider before partaking in some of those activities. Risk is not equal across populations. So people with extra risk for serious illness, that are immunocompromised, maybe recovering from a medical procedure, a recent surgery, for cancer treatment, things like that, they should limit their social interaction as much as they can. Smaller group sizes are better. Outdoor, spaces are better than indoor spaces. The larger the space, the more opportunity for social distancing, the lower the risk. Again, we're talking about a proximity of about 6 feet in space, and some estimates have shared, or some studies have shared, that if that proximity is less than 6 feet for more than 10 minutes, the potential for transmitting the infection from an infected person to an uninfected person is very significant. Hence the utility and protections afforded by face covering. Have a talk without stressing the importance of everyone wearing face coverings. And then finally, on this infographic, everyone needs to come to a comfort level with their own risk, and deciding whether or not to dine in or get takeout is worth it. The experience is something that you feel is comforting or something you absolutely want to do. Just understand that there is increased risk, and if you decide it's worth it, great. Take the protections, wear a face covering, wash your hands, and so on and so forth. Next slide, please. This infographic is just illustrating kind of a fan type diagram of activities where risk is lower, outdoor recreation, camping, things of that nature. Proceeding on an opposite end of the spectrum to very high risk activities, high risk for transmission of the virus, which would be attending some of those things you see listed there. Again, for all activities, we want folks to stay home if they're sick or if they think they've been exposed. Certainly wear a mask when practical and feasible. Keep your distance, wash your hands frequently, and understand that there is varying risk from different activities, whether that's a wedding reception or party in someone's home, or recreational sports activities. Next slide, please. I've already covered these three main topics. This graphic we will be ordering some signage for that will be displayed in some upcoming events, including the Elbert County Fair. Will be in the form of yard signs that will stake in the ground, just reminding participants at the fair of these three main things they can do to mitigate transmission. Next slide, please. Okay, through federal funding appropriated by Congress that was appropriated to the Centers for Disease Control and Prevention, that is being run through Colorado Department of Public Health and Environment and ultimately coming to Elbert County. Elbert County Public Health is or will be receiving an allocation, not a flat check, but an allocation for over $440,000. You can see the exact figure on the slide. This money is intended to strengthen the public health infrastructure to detect and respond to COVID-19, both currently and prospectively. So it'll be a 30-month grant that can be used for case investigation, contact tracing, case monitoring and navigation, resource connections. I'll give you an example of that. If we have someone that's been infected with the virus and we issue an isolation order to that person, in other words, they need to self-isolate for 14 days while the virus runs its course. Previously, we've been asking folks to just do that as best they can, while we still understood that some folks may live in a household with a large family and may not have space available, their own bedroom, their living space, their own bathroom. So in many circumstances, that's difficult, if not impossible, for folks to isolate if they don't have somewhere to go. This funding will allow us to partner with a hotel in Southeast Aurora or Castle Rock or somewhere else nearby, where we can cover the cost of that person isolating in a hotel and hopefully assure that they are not exposing other folks. It will also allow us to meet the needs of that person in isolation, everything from meals to transportation, whatever that looks like. We're going to be figuring a lot of this out as we go. The state is providing some guidance and some templates for how we do this. But obviously we have a unique situation here in Elbert County that may not be as easily or conveniently addressed by some other counties in the metro area. This funding will also allow us to identify and implement a disease control strategy that is for more than COVID. Historically, our disease investigations may have been for hepatitis B or hepatitis C or tuberculosis. This will allow us to build capacity with our disease investigation and response capabilities here at the health department for all communicable diseases moving forward. The funding will also allow for public and partner communication and education. Not sure exactly what that looks like right now, but we will be developing that plan and that scope of work. And also mitigation activities in the community. That could include things like flu clinic come next flu season in late summer, early fall. The county leadership will be developing the scope of work and looking at the documents here. I believe that is due to CPHE on August 15th. I should also mention that this funding allows us to retrospectively submit for reimbursement of expenses for a period dating January 20th of this year to June 30th. For example, for payroll salaries for folks that were pulled into the COVID coordination and response that typically worked in other departments at the county. It's been a significant team effort, a significant lift. So that will certainly help the county's budget a little bit in that space. If you have questions, thoughts about this enhanced detection and lab capability funding, please connect with me. This is a 30-month grant. It is going to be in the form of monthly payments tied to reporting on deliverables. It is not a cost reimbursement grant. Just looking at some other notes here from this document. So all this has come down in the last week or so with more specifics. We knew we'd probably be getting some funding, didn't know exactly how much. But this is truly a watershed moment for our health department to build capacity, not only for communicable disease investigation, but we also want to use this funding to hire a nurse that will eventually allow us to expand our scope of services for Elbert County residents to include things like maternal and child health, immunization, and a variety of things that we have in recent years not been able to offer to our residents. So this funding is coming at the right time. It's absolutely needed, and we will certainly be good stewards of this funding and use it in the best possible framework to improve the health, not only the physical health, but the mental health for Elbert County residents. Next slide, please. Okay, I think this is Sam. Where Sam's going to jump in here.
I'm going to kick it off, and then I'm going to ask Jerry to help me with this a little bit. So Dwayne, thank you very much for the presentation and all the work you've been doing, kind of leading this COVID-19 emergency. Jerry and I have had some discussions, and we've also talked with our counterparts in other counties, and it's our recommendation at this point in time that we split off public health into its own directorate, and it's gonna be more efficient in the use of this extra money that's coming down and in providing services to the citizens of the county. We want to make that effective 7/1/2020, and there's still a lot of details still to be worked out with the transition plan to be developed and delivered to the Board of Health as soon as we can get some details on that plan. Again, it's going to allow us to focus on the different COVID-19 phases, and then allow us to provide staff and resources to meet the needs of the county. And Jerry, did you want to kind of talk about this a little bit too?
Yeah, that would be great. Thanks, Sam. This is Jerry Speer, Director of Health and Human Services. I asked Sam just to spend a couple of minutes because I know the history of how the Public Health Department and Human Services Department was combined. That was started about 7.5 years ago when I started as the director, when I came to Elbert County to work. My background has always been human services, and I've been a director for many years in that arena. But that at that point in time, that the board wanted to combine. I think there were several reasons. That one was that just we were both departments at that point in time were co-located in the same building, and both were in need of directors, and the public health finances were pretty stressed at that point. So there were some different reasons they combined us, but at the same time, we also had some amazingly skilled, talented, and tenured public health employees that could carry on the overall work. And so my role was just to basically oversee the higher agency needs and kind of combine all of it, see what we could combine and collaborate on processes and systems to make it more efficient. And over time, we have seen some of those efficiencies. The public health finances have really been rebalanced, and they're no longer in that level of distress. And as Dwayne and Sam pointed out, now with these extra influx of dollars from the COVID, we can maybe do some really structural building. And I've always assumed that we would split out the two departments at some point in time. But as many of the commissioners know that have been around with me for a while, we know that we've tried different models, we've had different personnel, and it's just never been the right timing. And I think I'm supportive of Sam. We've talked about this for probably a couple of years when we found the right person, the right fit, the right timing, that it would be a good time to make this recommendation to go ahead and split the department back into two agencies now. And obviously, as we all know, we've watched Dwayne these past few months. He got kicked into the deep end really quickly. He started at the beginning of the year. We thought, I was assuming that with Dwayne at the helm that we'd be coming to this conclusion anyway, maybe by 7/1, maybe by the end of the year. But Dwayne got kicked into the very deep end of the pool quickly with the COVID-19 and has proven himself so well for all of us. I think this just really makes the most sense that he has more than proven himself to take over be as a director and to make this work really well. We will have, as Sam pointed out, we're going to have to do some transition planning because we're not only co-located, we also combined some personnel resources and different resources over time. And so we're going to have to really walk through a lot of those processes to see what we need to separate. We're probably going to have to put, since we were under one umbrella as one agency, we didn't really have to put any MOUs together because as one director, I could cross over both of the different, the two different agencies, and we could utilize one personnel or several personnel for the different roles in the agency. So we'll have to develop some MOUs just between the different, both sides of the agency. Like I say, we'll still be in the same same building, we'll still be co-located. And the really nice thing is over time, it's a great collaborative process that we've developed, so we can see how we can work together, and we just don't have to be under one, we don't have to be under one name. But there will be, as you said, there will be a little bit of time for us to get some of this transition plan developed. But I just want to let you know that not only Sam is recommending this, I've been thinking we'd be doing this for many years. We just finally hit the right point, and I think this is good timing.
Thanks, Jerry. Commissioners, Board of Health, is there any questions on this recommendation? And we'd like your permission to move forward with this.
Yeah, this is Chris. Yeah, I think you're right. The timing is right. I mean, I think we've certainly transitioned from a period when public health was focused on septic inspections and rabid skunks. It's certainly now become a focus. And I think a separate department allows us to work those priorities together. And on the human services side, the safe at home, safer at home, certainly we've seen increases in severity of the caseload that is being carried there. And I think in order to be able to, for Jerry to be able to focus her team specifically on the human services side, that's kind of ramped up, as well as Dwayne on the public health side, I think it's the right direction to go. I'm sure there's probably some paperwork to follow. As a Board of Health, we really can't break up the county structure, but both departments, both areas fall under USAM. So I think start moving in that direction, and then at our whatever appropriate BOCC meetings we have, or to do the specific appointments and the other paperwork that always follows things like this, I think is the right place for that formal decision. But obviously we've been practicing that way now for, I guess, going on 3 months, if not 4 or forever. I don't know how long 2020 has been now. So anything your side, Grant or Rick? Or?
This is Grant. I'm in favor of the reorganization. It makes sense to me.
Yeah, I agree with everything that's been said. So time to move on.
Okay, well, good. Then, Commissioners, we'll add that to the next BOCC agenda as a kind of an update item as we go forward. And thank you for your support. And Dwayne, good job.
Thank you. And just like to express my thanks and gratitude. This has been a team effort as we've navigated this challenge over the last many months. So I want to recognize Sam, Eileen, Bart, Alex, Chris, and Sheriff Norton. And for many folks that may not be aware, Elbert County has had the good fortune and good leadership to experience a harmonious path through this epidemic. That has not been the case in several other counties. So commissioners and the rest of the county leadership, I want to express to you my thanks for your collaboration and your support. And I don't think we'd be where we are today in terms of the good space that we're in without that support. So thank you very much.
Thank you, Dwayne. It's really, I don't know, it's been an interesting few months, as you said, but yeah, to see what's been going on in other counties or other places where I know we're not as unique in being our own Board of Health as the Board of County Commissioners, but yeah, there's a kind of a complexity in every county that's a little different. But I think ours is, we're very collaborative, but we're bordered by folks that have had much higher case rates, and so I think everybody's set of considerations is different, but it's good to be moving forward, and it's nice to see day after day after day of no cases. Hopefully that sustains, but I know we'll have some others pop up, I'm sure, but I think we've got a good processes in place to address things and more being built. So thanks for all your hard effort on that. if we don't have any other business, I think we can adjourn this. If I take a motion.
Also move, we adjourn.
Second,
All righty, we've got a motion and a second. All in favor to adjourn, say aye.
aye.
Aye. Motion carries. It's 12:50 and we're adjourned. Thank you very
Thank
much,
you.
everyone.